In this video, we're going to show a real-time treatment to open up and loosen the hip flexors. We're going to be using the KOAPRO Massage Tools along with some stretching techniques to really create space within the tissue, reduce pain and tension, and get her better range of motion.
So for sure, whenever you do deeper treatment, you want to focus a lot around the area because you're going to stimulate a lot of blood flow, and you don't just want it to kind of stay localized to that area. You want to make sure above and below it has really good circulation. So again, you're very healthy, you have very good circulation. As an athlete, you're going to already have a really good pump. So we're just kind of helping it all move up, and then I'm going to do the scraping technique going upwards as well. This is something you can work on kind of little by little. I don't want to be too much too soon, even though I know your body can take deeper treatment, but there's no reason to kind of piss it off too much. You can do it layer by layer, and then also your body also relaxes between sessions, so you can give it that time to heal.
And how long is a good time in between sessions?
The rule of thumb, because it's different for everyone, is you don't want to use it when you're sore. So if you feel some post-workout type soreness the next day or the following day or the third day, you wouldn't want to do another massage over those sore areas. You can massage somewhere else, but you don't want to, if it's tender, definitely if it's bruised, you don't want to do any kind of deep tissue work over that. You can do very light massage, but in general you just kind of want to let it heal itself. So this technique is called fascia. It's a very ancient Eastern Asian technique. They used a lot of different coins and spoons and things to scrape people, and it really stimulates total body circulation. They call it ki, like energy. So in Eastern medicine, if you have stuck energy, it manifests as tension in the body, and it can manifest as illness and disease if you essentially let it stay there. So by mobilizing it with a technique like this, you help it move throughout the body, and what you're doing is stimulating the lymphatic system, the circulatory system, and all the body's detox processes, so it helps your body move out waste. The rule of thumb is to go towards the heart. We're helping move the circulation back up towards the body. And in this case, we did a lot of deep tissue work right here on the hip flexors. So we're just kind of helping everything move up and out. Woohoo. The side glute muscles attachment, the hip flexors, and the quad attachments are just kind of all stuck. Sometimes it's like a little treasure hunt because you find the path of the issues. What does that feel like?
Not very good.
Feel that. So when something's really sensitive like this, and especially when it's a very kind of thin or delicate area like the ankles or the wrists, I use my knuckles to just sort of desensitize it because they're a lot softer and the body is just sort of more comfortable with skin to skin. There's this same little fascia highway or highway of connective tissue that can get really stuck between the two larger muscle groups. So same kind of thing as the IT band, you can go in between it. Then you find these little tension, adhesion spots. Just kind of loosen it up. Some scar tissue there. So what I'm doing is creating space between the tissue, and it's also relaxing and even elongating the connective tissue. Right there on that little bridge of the foot too is super important to loosen up.